Hi, I'm Dr. Ryan Wells. I've been practicing dermatology for 7 years. I went to medical school at the University of Alabama at Birmingham, down south. And then I moved up north to University of Minnesota for a dermatology residency. I'm originally from Mountain Home, and I've been back in the Boise area for 2 years now. I'm actually board certified in both internal medicine and dermatology. So I think that's really neat. Dermatology, I think, is awesome because I once likened it to sort of having a superpower, because a lot of other physicians will see the same things that you see, but then when you come and look and examine the patient, oftentimes very quickly after just a few minutes of listening to their history and looking at doing a pretty comprehensive skin exam, you can know exactly what's going on with the patient. I consider myself a general dermatologist, so whatever walks in the door, I'm happy to look at and diagnose and treat. Because I am both trained in internal medicine and dermatology, I really get excited about kind of complex medical derm. So a lot of the dermatological manifestations of like rheumatologic disease, cancer-related dermatoses, or even side effects from different cancer drugs or other systemic medications. Those are the things I really get excited about. But I love all aspects of dermatology, from seeing kids to adults to the elderly and any condition that goes along with it. One thing that I wish patients would understand better is that anyone can get skin cancer. So I often hear the question a lot of times from individuals with a little bit darker skin tones that, oh no, I can't get skin cancer, I'm naturally protected. And while that's true to an extent, everyone can get skin cancer. And it does have to do with your cumulative exposure to the sun. So that's one thing that I think would be great if everyone understood. And then the second thing that I really wish everyone would understand is that there's really no such thing as getting tan to help protect yourself from skin cancer. So any type of browning or tanning of the skin is actually a sign of skin damage from the sun. Dermatology is awesome because you do see a lot of kind of strange and interesting skin diseases and infections and things like that. So one of the most interesting things that I've personally seen, it kind of has that U factor or ick factor, and that was myiasis. So what we call cutaneous myiasis, which is actually an infection of a botfly in the skin. So a larvae of the botfly grows in the skin, and the only way to get it out is to kind of coerce that little bug to come out, either by cutting it or suffocating it. But you should Google botfly myiasis, and you will see some amazing videos. Someone had been traveling, so you pick this up in like Central or South America, and basically the fly can either lay eggs directly on your skin, or it can lay eggs on your clothes as they're drying, and then you put that clothes on and eggs then get on your skin, and basically you end up growing a fly larvae in your skin. I think a lot of us got into medicine because it always is new and changing. And so one thing that I try to do to keep current is read different medical journals. There are a lot of different blogs out there that, can have some good information, some of them. So you just have to be careful really with what you're kind of looking at in terms of those blogs. But I would say just constantly learning, constantly, going back to the basics, reading textbooks, and then looking at journals and, new studies that come out, and kind of compare what's new with sort of, what's kind of been accepted as knowledge. The most important thing, I think, in looking for a dermatologist is looking for someone that's a board certified dermatologist. And what that means is that someone who has done a residency in dermatology and has kind of gone through all those official steps to be recognized in the community as someone that is a professional in that field. And then I guess after that, if you get along with them, if they have good clinical acumen, sort of bedside manner, things like that. I would say everyone at some point in their life should see a dermatologist. Definitely younger patients should see a dermatologist if they do have ongoing active skin issues. Anything from rashes, eczema, acne. Those are some of the common things for younger patients. But really, I think anyone, say over the age of like 35 to 40, should see a dermatologist at least once just to get a good baseline exam. And based on that skin exam and some of their risk factors and whatnot, it can be determined how frequently they should see a dermatologist after that. Personally, I think my best skin advice is the more simple routine you have is usually the better. So you'll see a lot of times on popular like on TikTok or YouTube videos, people doing all sorts of like skin routines where people are applying like 5 to 10 different products. It takes like an hour to do each night. Honestly, I think the simpler routines are the better. So what I always recommend is every day someone should be wearing a type of lotion or facial moisturizer that has SPF. So some type of sunscreen that can totally help prevent skin cancer, but it can also help the effects of skin aging. And really other than that, just a good kind of gentle moisturizer or gentle facial cleanser can really go a long ways. So yeah, I grew up in Mountain Home here in Idaho. No, my family wasn't in the Air Force. We were just there. My dad was a physician, and so grew up there in Mountain Home, going to school and able to do sports and things like that. So I really enjoyed that, living in a smaller community and being able to participate in all of those activities. And those are a lot of the same things that I still enjoy about living in Idaho. So I have 2 daughters now, and I'm excited for them to be able to grow up in Idaho and be able to go and do outdoor activities, skiing, whitewater rafting, things like that, but then also be able to just participate in school activities. Advice I would give to myself at age 15 would be that don't run cross country. You did not like running cross country. You've loved playing soccer, so go play soccer. I think a lot of times in life, as well as in medicine, we can tend to get in the habit of just sort of like knee-jerk reactions. Like if we see a certain pattern, again, in life or even in the clinic, if you see a certain pattern of something, then you're kind of trained to come up with that immediate, like, again, kind of like a knee-jerk reaction, which is, it's good to have that, but also it's very good to still be thoughtful and ask yourself, okay, this fits in these different ways, but is there something I'm missing? Is there something I ought to consider as well? And again, I found that to be super helpful, both in my personal life as well as in the clinic with patients. I think one thing that surprises people about me is that when they learn that I've lived in Africa for 3 years. I lived in Botswana for a year. I lived in South Africa for 2 years. Both of my children were born in South Africa and are mixed race. So I think that just coming from Idaho, coming from a small town in Idaho, a lot of times people are surprised of that. If I wasn't like a clinician working as a dermatologist in the dermatology clinic, the other career that I would pursue would be just medical research. So I do have a PhD in microbiology, and I get super excited about microbiomes and things like that and how the microbiome affects health. So I would definitely try to be like a professor at a university and be doing research. I think there's already been a ton of like advances and insights made into microbiome and skin health, and just how, for example, like gut health and microbiome, gut health can really affect conditions like atopic dermatitis. We definitely know there's gut-skin connection with conditions like celiac disease and dermatitis herpetiformis. So I think those types of discoveries will continue to be made. And I think so right now we know there are those connections, but I think what will be really interesting is potential therapeutics that will come from that. So I'm not telling everyone to go out and rub their skin in yogurt just yet, but who knows, maybe in the future. Dr. Greg Wells and I are cousins. What's interesting is his dad and my dad are twin brothers. So, and they obviously were very, very close. And because of that, they had houses next to each other. So Greg and I grew up next door to each other. There was a field that separated our properties and houses. But fun memories I have as a kid would just be to go out in the backyard and yell across the field, "Hey, Greg, what are you doing?" You know, and then you'd wait a little while and then he would yell back across. And so you didn't even need to use the phone. You could just yell to your cousin and see what they were doing. Just go and play in the fields behind our houses, ride our bikes, try to build underground forts, things like that. They never worked out.